We have a lot of people in here with autoimmune that's in our group.
Oh, yeah.
So working on autoimmune disease, they're wanting to know different levels of different types of autoimmune. How do they know? First of all, I always try to explain the science of not going past the 72, that the science doesn't get that much and staying consistent. Is there any other inputs you can give for autoimmune besides
Yeah, this is totally what happened this morning in my support group, as someone talked about. So I think God blesses me when people come to my support group and they tell their stories. Because it's almost like I'm getting a whispering saying, keep going, even if I've had some setbacks and I've had, things that don't go my way. And I'll tell you, before you move your family across the country at the age of 50 with teenagers, think about me. Like, oh my goodness, what's happened in the last year? I just feel proud that I can get on a live show once a week, and I'm still putting out some YouTube videos right now. But looking at that, what happened this morning is this man who's been coming, he came because his wife was keto, and now he's a super strong athlete in his late 60s, advanced baseball player. And he's like, well, she's a type 1 diabetic. So I've just been doing keto with her, and he got stronger and leaner, and his brain got sharper and his energy went up. And you're like, oh my gosh, this keto could work for me too. So he brought his daughter today, and his daughter says, there's this woman in my community who said, there's this anti-inflammatory diet that I've been on, and I've had lupus for so many years. I've been on this anti-inflammatory diet for a few weeks, and I just can't believe how much better I feel, how much less my flares are happening. And it just was like, okay, yeah, continue to tell people that, just like I was saying, when people first get on that ketogenic state, they lower their insulin a little bit, but then as they continue to stay consistent, and the way they know they're consistent is they're measuring the two markers that predict inflammation. They're measuring their glucose and their ketones. And if their glucose and ketones are at the right level, that drboz ratio will be less than 40. When I have patients show up and say, can I have this reversal of an autoimmune disorder? I never know if any of those cells are still alive, but I never remove hope, because it just takes some stories like multiple sclerosis, Crohn's disease, ulcerative colitis, rheumatoid arthritis. These are autoimmune problems where the immune system is in there attacking those cells, and they're going to keep deteriorating if you don't shut them off. In many ways, CLL, the cancer my mother had, is another autoimmune problem where the white blood cells were deformed. They're not working right because of what's happening in her bone marrow. And as she got less and less and less inflammation, her system was able to heal. So when you look at where that process is to say, well, do I need to follow any of these rules? Is it ever going to work for me? If you have an autoimmune problem, when your body's done destroying one organ system, it picks another. One autoimmune problem predicts the next. If you look at physicians that take a history for pregnant women, meaning we allowed a being to grow inside us without killing it. Okay, that means our immune system was suppressed during that time. And during that section of gestation, it sets you up for autoimmune problems. Number one autoimmune problem after somebody's been pregnant is their thyroid doesn't work right. Why doesn't it work right? Because their white blood cells are now, their immune system is attacking their thyroid. And then comes another one, and then comes another one. So even if you say, what, I've had every joint in my body replaced, I have, whatever, autoimmune or this is a terrible life. There's another one coming. So improving that drboz ratio, getting that inflammation as low as possible. And then praying. I've seen miracles happen where they are in an advanced wheelchair. They are about to put them on life support to help them breathe because of Lou Gehrig's disease. And that's what they called it. We think it might not have been Lou Gehrig's disease because of how much it reversed, but everybody thought it was Lou Gehrig's disease or ALS because of what was happening, which is another autoimmune problem. And when they lowered that inflammation down to the lowest level, something miraculous happened and the body healed. And I don't guarantee that. I don't want to overpromise that, but I know the only way to have access to that is that the inflammation must be as low as possible. And that is a very advanced state of ketosis. And you can't be there for a day. This took 10 years or more to start showing symptoms. So when I tell, what's your brother's name again? James, that he needs to stay in advanced ketosis as he prepares for the race. And the best outcomes are if you're at 18 months. that's you too for autoimmune disorders. You're not going to get the best outcomes till you've been in a steady, constant state of ketosis for 18 months.
So can they actually get a good DVR if they're already on prednisone? I know Isabel's worried about, she's already on the prednisone and wants to know how to get off.
Yeah, I had this exact, right. Yeah. So I had this exact same question this morning too, saying if there was ever a patient that these products of supplementing ketones are for, it's for you. In somebody who has insulin resistance, or they're in a state where my prescriptions are causing a higher glucose state. I need ketones in circulation, because as soon as ketones are in circulation, they tell your liver, hey, make me some ketones. And that's how people like James, where they get into a state of ketosis and the next layer is easier and the next layer is easier. And now he's making and producing ketones so well that he wakes up in the morning with a ketone level of 2.4 or 2. Great numbers. That's not everybody. They don't push their bodies that hard. When I see somebody whose glucose is high or higher than it should be, you can't make ketones when your glucose is that high, because insulin's high, and higher insulin shuts off the production of ketones. So when people say, oh, I just don't make ketones very well, I'm like, no, your immune system hasn't, or your metabolism hasn't been flexed or exercised or stressed. And the way you stress an immune system is a few things that if you're on prednisone, you can try. You can go into a sauna, you can try exercising with weights, or you can fast no more than 72 hours, but you could do that. And that's asking a lot for these people who are really weighed down with some pretty heavy medical problems. So I tell them, exercise your mitochondria by improving the circulation of ketones by sipping on ketones until you get off this prednisone, or at least until you feel you can do a fast for 36 hours. And then you don't do one and you're better. You got to join me every week for a fast.
I'll even say the BHB helped me so much. Even when I was taking myself off the Oxycontin and it blotted, that BHB was my lifesaver. So
it's fuel,
I mean, it's just, it didn't matter what I was doing. I just felt like crap. I mean, I wasn't having enough glucose for energy or fuel, but I wasn't making enough ketones for fuel either. So those ketones are a lifesaver.
You do not need it forever. It definitely has a bridge of time. And then you say, okay, now their metabolism is better. But if they stay stuck there, they don't get out the other side without something extreme happening in their metabolism.